I'm Michelle Farr. I'm Senior Research Associate at Clark West. We did a research study looking at online consultations in 36 GP practices through Bristol, South Gloucestershire and North Somerset. Mm-hmm. We were looking at a platform called eConsult, which gives patients the opportunity to go into the internet, onto the GP website, to consult their GP online. So we found that actually when GPs were looking at what was given to them online, that sometimes there wasn't actually enough information to make a decision there and then they actually needed to either phone or see the patient face to face, and that occurred in 70% of online consultations. And in these cases it could sometimes actually be duplicating GP workload because they'd first read the online consultation and then have to see the patient as well. So we found that it was actually simple inquiries that work best for online consultations. So that might be things like a patient getting their test results, it might be a simple kind of question about medication they're on, or it might be something like a fit note. Some patients were actually using the system because they knew they needed a face-to-face appointment, but actually they maybe couldn't get through, and so people saw that was one way as another way to contact them. But actually what that meant was that then that was actually duplicating workload for GPs. What would be really useful is for patients to be given guidance of when it's more appropriate to use an online consultation system if they've got a very simple question, but actually to book a normal face-to-face appointment through the usual route. Overall, we found that online consultations can't replace face-to-face appointments for many kind of complex or new symptoms, and so they're useful in some circumstances but not all. So they need really careful marketing to patients so that they can actually be beneficial to patients, which they certainly can be, but also beneficial to GPs so that they can actually deal with some simple queries remotely and quickly, and that might actually improve their efficiency as well.